A very good evening to one and all. Myself, Dr. Rakesh Bobba. I am working as a consultant endocrinologist at Aster Ramesh Hospitals, Vijayawada. Today, on behalf of Endocrine Society of India, I would like to welcome all the audience to this Facebook live session on lifestyle mantras in diabetes. November month is celebrated as Diabetes Awareness Month. In India, nearly 8 crore people are suffering with diabetes, and nearly 10 lakh people die every year due to diabetes related complications. Sadly, nowadays, internet is being flooded with so much of false and misleading information about diabetes management and lifestyle practices. So this is causing so much of confusion in our audience and general public. So to dispel all these myths and clear the confusion, Endocrine Society of India is conducting diabetes awareness programs every Saturday in the month of November to educate and create awareness among general public and diabetic patients about management of diabetes. So in today's session, we have 4 expert panelists from all over India to discuss about healthy lifestyle practices in diabetes management. So our first panelist is Professor S.V. Madhu sir. Sir is Director Professor, Center for Diabetes Endocrinology and Metabolism, University College of Medical Sciences and GTB Hospital, New Delhi. Sir was past President RSSDI and Endocrine Society of India. Sir is current Editor-in-Chief for IGEM. Sir, it's our honor and privilege to have you as a panelist, sir. Very warm welcome to you.
Thank you. Thank you all.
Our second panelist is Dr. Sridevi ma'am. Ma'am is a consultant endocrinologist at KIMS Hospital and also Siri Diabetes and Endocrine Center, Secunderabad. A warm welcome to you, ma'am.
Thank you. Thank you for the opportunity.
Our third panelist is Dr. Sandeep sir. Sir is a consultant endocrinologist at Dr. Sandeep's Endocrinology Super Specialty Center, Hubli, Karnataka. A warm welcome, sir.
Thank you. Thank you.
Our last panelist is Dr. Poonam Jadhav, ma'am. Ma'am is a dental surgeon at Dr. Poonam's Dental Clinic, Indore, Madhya Pradesh. Ma'am is a type 1 diabetic herself. So we are looking forward to learn from your own personal experience, ma'am.
Thank you so much, sir. Thank you so much.
So without further ado, sir, as Madhu sir, I would like to request you to enlighten the general public about the importance of healthy lifestyle in management of diabetes.
Thank you, and welcome to all the audience who have logged in and who are listening to this Facebook Live program on behalf of Endocrine Society of India. Lifestyle basically refers to the way we conduct our day-to-day lives, and this has a huge impact on our health and disease. And insofar as diabetes is concerned, I think lifestyle management or lifestyle forms a very important component, or in fact, the most critical component of management and prevention of type 2 diabetes mellitus per se. Not only diabetes, if we indulge in healthy lifestyle, and we will be discussing various aspects of healthy lifestyle during the course of the next 1 hour, the healthy lifestyle not only would help prevent diabetes and manage diabetes, but also would help prevent and manage the associated conditions with diabetes, which we all are aware, like hypertension, heart disease, cancers, and so many other diseases, which are all called lifestyle disorders. And what is lifestyle in a healthy lifestyle? In a way, we should have a healthy food habits, a healthy physical activity and exercise regularly, and of course sleep and some other components which we will discuss. And as long as we maintain a healthy lifestyle, apart from general health and cardiovascular fitness, it helps manage and prevent diabetes and manage our sugars much better. With that introduction, I think I'll get back to Dr. Rakesh for further questions.
Thank you, sir. Sir, as you have rightly mentioned, lifestyle management is the fundamental aspect of diabetes management, and it is sometimes as effective as medication. And even in some patients with good lifestyle practices, they can reverse their diabetes and they can go off medications. Sir, coming to our today's sessions, like many patients have a lot of confusion and doubts about diet. What is the ideal diet for diabetic patients? Like what carbohydrates they have to prefer? Is rice good for them, or millets, oats, or chapati? So can you throw some light and educate the patients about what should be their ideal diet should be?
Okay. As I said in the beginning, unhealthy diet is one of the most important causes of diabetes and improper sugar control in a diabetic patient, and therefore we should focus on the diet. In fact, uh, one of the most important lifestyle measures or to be focused on by all patients and they need to know is exercise and diet. And diet we're focusing now as far as carbohydrates is concerned, I think most of the diabetic patients and in general most individuals in our country take their calories or energy from carbohydrates predominantly. About more than half of the calories in most diets are from carbohydrates. So, what kind of carbohydrates we can take? Because we all know, and most of the audience would also be knowing that it's the carbohydrate which gets converted to glucose and gives us energy. And therefore, we have to take carbohydrates, but we have to be cautious that it doesn't raise the blood glucose levels suddenly and precipitously to cause a lack of control or loss of control. Therefore, what is advised is you do take carbohydrates in the measured amounts. 50 to 60% of carbohydrates in your diet or as energy is recommended, but you need to take what we call complex carbohydrates, and these include grains instead of refined carbohydrates. You need to take whole grain based foods, whole wheat, whole mixed grain cereals. We need to prefer brown rice over white rice if at all we need to take rice, and try and avoid processed foods, maida, and all those things which are supposed to give free sugars very easily, and they're also called refined sugars and simple sugars, and they tend to raise the blood glucose very fast, and they're detrimental to diabetes control. So in general, carbohydrates cannot be avoided. We have to take them, but prefer what we call whole grains, brown bread compared to white breads, whole grains compared to processed foods, and simple sugars. Avoid free sugars as much as you can. Fruits you can take. It's not that fruits are banned for a diabetic patient. You need to take them in a limited amount according to the servings which are advised for you. Uh, it's better to prefer what we call glycemic index. That means a carbohydrate which does not raise your blood sugar levels very fast is a low glycemic index food, whether it's a fruit or a food. So you can take a low glycemic index fruit, and the choices would be, you can take apple, guava, let's say oranges, and all these fruits in limited amounts, and try and avoid mangoes, grapes, ripe bananas, and the kind of fruits which have a high glycemic index, as we call them. Thirdly, some people also seem to be having a notion that, while we have to avoid sugars because it will raise your blood glucose level, we are free or open to take good or jaggery, as they call it, and it's perfectly safe. But I need to, dispel that myth straight away here. Although it is a carbohydrate, both are carbohydrates, both have sugars, and jaggery or good is as bad as sugar in terms of raising blood glucose control. Yeah, sometimes you may find that the glucose level lies a little slower, but by and large, best as a message, if you avoid sugar, you avoid it in any form, including good and jaggery, and even honey, which has a lot of energy and a lot of sugar. So these are not substitutes which can be given in place of sugar, which many people tend to think. So overall, broadly, these are the kind of carbohydrate uh, foods that we advise and ask them to avoid.
Thank you, sir. It's very crystal clear. So always we have to prefer complex carbohydrates over simple carbohydrates, and always try to take your carbohydrates in a coarse form rather than a refined form. So prefer brown rice over white rice, multigrain bread over white bread, so etc. And try to avoid refined products like maida. As Sir has mentioned, fruits with low glycemic index are good for diabetic patients, and you can have one serving per day. And sir, what about artificial sweetness? So many patients are in the habit of going for sugar substitutes and artificial sweetness in place of sugar. Are they good for diabetic patients in long term?
Actually, artificial sweeteners in the amounts that we prescribe are not unsafe in that sense, and they can be taken in limited amounts, especially in a diabetic patient that we advise. But if you take them in large amounts for long periods, now it's been um, things are emerging that it may not be as good and as uh, beneficial as was thought earlier. and therefore best would be for a patient to avoid the sugar and get used to it. It doesn't take long for the habit, sugarless food or unsweetened food. It doesn't take long at all. One just has to try it because he's been used to taking the sugars and sweet foods. He feels that, avoiding sugar, he needs some kind of a sweetener. But the best would be to avoid it altogether. And I'm sure within a couple of weeks we'll get used to it. But if there is a real need and you cannot avoid, small quantities of artificial sweeteners can be taken by the diabetic patient, the ones that are recommended, but definitely not in large amounts and definitely not for long periods.
Thank you, sir. Next question is to you, Sridevi ma'am. Ma'am, as we all know, dairy products are important source of calcium and they are very important for bone health. But can diabetic patients take dairy products like milk? Because many are apprehensive in taking milk and other dairy products. So, what is your advice to them?
Yeah, nowadays the vegan diet is gaining more popularity without any animal protein or something. But especially for vegetarians, the dairy products are a very important source of protein, calcium, and other minerals like magnesium and all. So actually, they should not be avoided completely. But one and all the dairy products are definitely सब चीज एक जैसा नहीं है. जैसे कि बटर मिल्क या आप घी अलग है और बटर और चीज अलग है एंड देन आजकल लो फैट आई मीन कम फैट वाली मिल्क और मिल्क प्रोडक्ट्स मिल रहे हैं तो सो चूजिंग सो इफ सपोज बटर मिल्क इज देयर इट्स अ गुड ऑप्शन इंस्टेड ऑफ फ्रूट जूसेस फॉर पीपल टू मेंटेन satiety and in between meals. So all dairy products are not the same. The milk में जो carbohydrate है that gets converted to glucose and sometimes there might be a spike in blood sugar. So moderation, it is recommended to take, the ADA recommends 2 to 3 servings of dairy products. But I think approximately say 100 ml of milk twice daily without any added sugar, I think that will give enough amount of calcium and protein to the patients. But yes, if you are introducing it newly, especially in a type 1 diabetic patient, तो आपको शायद bolus dose of insulin का adjust करना पड़ेगा. So next few days you have to monitor it regularly and maybe adjust the dose of medication if needed. But if taken in moderation without sugar, it is good. And as I said, buttermilk can be used as a substitute to fruit juices. But and cheese is again a good source of calcium, and lot of processed foods contain cheese and butter now. But now we have low fat cheese and all. But if weight concern is there and if the patient wants to lose weight, अगर वजन cut करना है तो you can take a low fat versions instead of in the whole milk versions of cheese or butter or low fat milk and all. And also it's also a good source of calcium. You might need to adjust the source of bolus insulin. So शुगर स्पाइक देखते हैं, लेकिन अगर आप दो दफा 100 ml ऐसा लेंगे तो आपका शुगर उतना बढ़ेगा नहीं. एंड शायद आपको स्पेशली टाइप 1 डायबिटिक में बोलस डोज एडजस्ट करिए. और चीज बटर ये प्रोसेस फॉर फूड्स वाला इसमें ज्यादा फैट रहता है जो वेट गेन और हाई कोलेस्ट्रॉल की रीजन बन सकता है. तो वैसे वाला प्रोसेस फूड्स अवॉइड करना चाहिए.
Thank you, ma'am. So, as ma'am has mentioned, majority of Indians are still vegetarians, and dairy products are major source of calcium and proteins for us. So, we can't completely avoid them, but always try to go for fat-free or skimmed milk and low-fat products. And ma'am, one of the most common questions asked by our patient is which oil is good for them. So we all know that oil can lead to increase in bad cholesterol, weight gain. So oil plays an important role in diabetes management. So which oil you prefer and how much quantity is ideal?
Now the agenda is no oil, healthy cooking, like oven use and so many AMC cookware and all. Without any oil you can cook. But actually no oil doesn't equivalent to healthy eating. Fats are very important for many functions in the body. And that's why even all the guidelines recommend at least 20 to 30% of fat intake, and most of the fat intake is through oils, at least in our country, which is used for tempering and many other purposes. So the moderation is the key. And first thing I want to definitely tell is avoid refined oils. Refined oils are processed in such a way that with extreme heat, so all the nutritive value of the oil is lost. So prefer cold pressed oils. That is the first message I want to give. Yeah, but cold pressed oils are expensive, but I think the health benefits are so much that I think patients can afford to do that. So first thing, avoid refined oils. And almost all fats, I mean all oils, are not the same. Some contain some good cholesterol, some good fatty acids. So suppose groundnut oil contains good of PUFA, sesame oil contains good of MUFA. So actually using oil alternatively or a blending also should be done if it is compatible according to the label. So you have to use, say, 1 month you use sunflower, 1 month you use safflower, 1 month you use groundnut. So you have to use oils alternatively so that you get the good fats from all the kind of oils, not rely on a single type of oil. That is very important, either blending or, because each oil contains different types of antioxidant products. Suppose, for example, rice bran oil is good for diabetics because it also contains a compound chemical called oryzanol, which is antioxidant properties. So sesame oil, mustard oil, groundnut oil, all these can be taken in alternatively to derive the benefits of good fats from all the oils. But moderation is the key. Avoid deep fried items, and containing very high fat like dalda or vanaspati, which is a saturated fat, which is more harmful, and it will increase your cholesterol. So choose oils which are cold pressed, and the recommended is about 20 to 25 ml per head per day. So in of blended or alternatively using different oils in different months. So that is, I think, the right way of choosing oil, rather than sticking to one type of oil, because you will be derived of the beneficial effects of other good components of other oils.
Thank you, ma'am. So as ma'am has clearly mentioned, it's always good to alternate oils like olive oil, rice pan oil, or sunflower oil, and limit the usage of oil. Try to avoid deep fried foods so that you can have a good glycemic control. Ma'am, what about salt? We all know that salt is bad for blood pressure, and it's avoided in hypertensive patients. But
Yeah.
in diabetic patients, even should they avoid salt, or can they consume salt in limited amounts?
Yeah. So actually, salt may not be directly related to diabetic control or sugar control, but most of the diabetics are having hypertension, especially type 2 diabetics are obese, overweight, and have hypertension also. So it is a very common comorbidity which increases the risk of heart and kidney problems. So therefore, salt, and also salt is directly related to fluid retention and weight gain. So all these problems will be there with excess salt intake, which increase the risk of having heart disease and kidney disease. So in diabetics, you have to, even the WHO recommends for anyone, it should be less than 5 grams of salt intake per day for anyone. And if the patient is a diabetic and also overweight and has some kidney issues, less than 2 to 2.5 grams of salt per day is recommended. ये कैसे कर सकते हैं कि avoid something like mixtures and processed foods and chips and all, which are contain lot of salt for preservation purpose, pickles and all, which contain lot of salt for preservation purpose. Such things should be added. And when you are cooking, measure the salt with it. Lot of people just sprinkle the salt on their estimation, लेकिन कितना डालता है उनको उतना अंदाजा नहीं होता है, तो ज्यादातर टाइम वो ज्यादा ही जाता है. तो इसीलिए साल्ट को मेजर करके आप कुकिंग में डालिए. और ऊपर से जो साल्ट डाल रहे हैं, जैसे कि आप कर्ड राइस में आप साल्ट शेकर के साथ स्प्रिंकल करते हो. सो इफ यू वांट टू मेक फूड पैलेटेबल, साल्ट एक ही चीज नहीं है. जैसे कुछ पेपर जोड़ दिया, कुछ चाट मसाला जोड़ दिया, तो आपका फूड टेस्टी बनेगा और साल्ट कम यूज हो सकता है. या
Thank you, ma'am. Thank you. Sir, Sandeep sir, next question is to you. So as ma'am has mentioned, nearly 50 to 70% of diabetic patients are overweight and obese, and many wants to lose weight. So many patients, they want to practice keto diet, intermittent fasting to lose weight in a faster way. Are these practices safe in diabetic patients, and what all precautions they have to take while following these diets?
Thank you, Rakesh, for the very apt question. So this is a very hot topic nowadays. So if you go back in history of diet, like some of the other time, we can see that there is some food patterns or specific foods which are in vogue. They are very much popular, telling that this will be beneficial in such a way. But when we look at diets which are beneficial and which have studies and data backing up, we can see that specifically DASH diet. DASH diet is the dietary approach to stop hypertension, or a Mediterranean diet, which basically is consumed by people living in the European region of Mediterranean region. So for these diets, it has been shown that it is beneficial for people with diabetes, and it's also beneficial for the cardiac health. So intermittent fasting is another kind of diet which has gained a lot of popularity nowadays. So it is very popular, but it has been present in some or the other forms since very long. So we can see that like fasting, such as religious fasting, has been practiced like generations together. Uh, so there are different types of intermittent fasting. It can be in the form of alternate day fast, where 24-hour fast is followed by regular eating of some days. For example, 5:2 pattern or 6:1 pattern, where they fast for 2 days and consume regular diet for 5 days, fast for 1 day and consume regular diet for 6 days. So this is one such strategy. Then the other strategy is like a time restricted eating, whereas in every day, a certain period like say 16 hours or a 20-hour period fast is followed by respective hours of window of eating regular diet. So benefit, if we say, there are no large studies which have looked at the benefits of intermittent fasting or keto diet, but there are many smaller studies. So smaller studies, the drawback is that uh, the population which they are studied on may not represent the general population. So that is one drawback of the smaller studies. So these smaller studies have shown benefit of intermittent fasting, such as in terms of controlling weight, uh, controlling the blood pressure levels, improving cholesterol levels, and improving blood glucose levels. Then there are other studies which have showed that intermittent fasting may not be beneficial when you compare it with general calorie restriction. So they have put forward various mechanisms which uh, show the benefit of intermittent fasting. Basically, in intermittent fasting, what happens is that there is a synchronization of food intake with the body clock, what we call as the circadian rhythm. And the other thing is there is a certain component of fasting in intermittent fasting, where when you deprive the body of calories, it tries to derive the energy from the fat which is stored in the body. So that way is one way which the weight loss also occurs. When we look at keto diet, it is another kind of diet. Here, the stress is on consuming foods which are having low calorie, they have high fat, and there are sufficient quantity of protein. Although this diet has been beneficial in certain specific conditions like childhood epilepsy, and it has shown benefit in terms of weight loss, blood glucose control. There are certain conditions which we have to remember where this diet specifically has to be avoided. For example, like patients who have kidney stones, who have very high cholesterol levels, because some of the studies have shown that this kind of a diet, the keto diet, it can increase the levels of certain components of blood cholesterol levels. And patients who have liver disease, gastroesophageal reflux disease, those who have poor oral intake, or those patients who have severe cardiac problems. So in such situations, definitely it is better to avoid uh, the keto diet. So all in all, whenever you want to plan any of these diets, like intermittent fasting or keto diet, we have to consider many factors. Like let's say blood glucose level, whether they are near normal levels or at high levels. So whenever there are very high levels of blood glucose levels, I would I would not want to try these kinds of fasting or diets in a new setup. So other factor is what medications they are taking, especially if they are on high doses of oral antidiabetic agents or insulin. So they are predisposed to having hypoglycemic levels. hypoglycemic, that is low blood glucose levels, that might be detrimental. Then, if the patients have other comorbidities, which might predispose them to low blood glucose levels. So, if at all these diets are planned in people who have diabetes, they have to be planned after consulting your healthcare provider, like your endocrinologist or your nutritionist or whoever your physician or doctor is.
Thank you, sir. So, as sir has mentioned, these keto diets and intermittent fasting, there are no long-term studies advocating their benefits. They're all safe for short-term, but the ideal candidate should be selected by a healthcare professional. So, it should be always done under supervision. Patients themselves are advised not to start the diets on their own, as it may affect their sugar levels and they may cause sugar levels to fall suddenly and may land up in hypoglycemia. So it's always safe to consult your doctor before starting such diets. Next question to Poonam ma'am. Ma'am, whenever we think of diabetes, we think of complications like heart attacks, eye problems, and kidney problems. But one of the most common and neglected aspect is dental problems. So, as a dental surgeon, can you enlighten the general public about what are the common dental problems in a diabetic patients and how can we prevent them?
Yes. Sir, actually, oral complications of diabetes is one of the most neglected area, and people are actually not aware of the oral complications of diabetes. So, whenever people or patients come to me with loosening of teeth, in common terms, we call it as pyorrhea. पेशेंट्स खुद बोलते हैं कि मैडम पायरिया हो गया है, खाना फंसता है दांतों के बीच में. So loosening of teeth, missing teeth at an early age is the most common symptom. In technical terms or in medical terms, we call it as the periodontitis. So it is the most common complications, and people should, whenever they have first instance of mobility in their teeth, so they should think of as if they are having poor control over their diabetes, and mostly it is indicative of poor glycemic control in patients with diabetes. So whenever I'll quote one of the examples from my clinical practice itself. I had a male patient of 45 years of age a couple of years ago in my clinic. He came to me with the mobility of teeth and pain in one of his mobile tooth. So the plan was to do extraction, but once I did the complete oral examination, I get to see that he had generalized mobility in all of his teeth. Some were less mobile, moderate, and high. So the first question I asked him was as if he had diabetes. So the answer was obviously yes. He, on complete history taking, he was a known diabetic patient for last 15 years, and his glucose control, his glycemic control was very poor. And whenever he used to check his blood sugars, it was in the range of 300 to 400. And it was very shocking for me because his oral health was very poor. And before starting the dental treatment, I first told him to have a good control, get his HbA1c checked, and if needed, he had to be shifted on insulins. So I educated him about all the things, but the answer was कि मैडम मेरे पास तो टाइम है नहीं और मेरा तो ठीक है, मुझे इस चीज से कोई प्रॉब्लम नहीं है. So patients are like these days, until and unless they have any major symptoms, they avoid getting the test done, the regular checkups done. And I mentioned also that until and unless you have very much the complication which has advanced to a different level, you won't have any symptoms. And unfortunately, 2 months ago, because he works in my neighborhood, I got the news that he fainted at his workplace because of his high blood sugars, and he was hospitalized and had multiple diabetes complications. So the message here is that do not neglect your oral health. And when you have your eyes checkup done, your renal checkup done, your everything diabetes monitor yearly, just get a dental checkup done as well, along with other things, because it is one of the most important clinical complications. And I have seen people losing all of their dentition because of the poor glycemic control. So periodontitis is a very common problem, and it is very much clearly indicative of the poor glycemic control. So whenever you feel that you are having a loosening of teeth, you have food lodgement in between your teeth, just get your HbA1cs done, do a regular monitoring. And to avoid and to prevent these things, you have to have a better control of your sugars. No toothpaste, no mouthwashes, nothing can help you but the good glycemic control. So a regular checkup should be involved in your annual diabetes monitoring. So this is the
Thank you,
things.
ma'am. Ma'am, as you have mentioned, like many diabetic patients and even elderly patients, they lose their teeth. With that, it will limit their options of food choices. Like,
Food
so they
choice.
can't have fruits or dry fruits, which are good for diabetic patients. So, in such patients, do you advise protein powders, or what other options do you suggest?
Yes, sir. Sir, actually, first thing is get your teeth replaced. Visit your nearest dentist, get the treatment options, take help if needed. We are having multiple options like complete dentures, partial dentures, even implants. If the people with diabetes are having good control over their diabetes, we are happy to give you implants also. So, first, have your dental treatment done, because the satisfaction of chewing with your teeth, the multiple food choices, it can never be replaced with the soft foods or easy to chew foods, because the satiety, the satisfaction which we get after chewing is unmatched. So get your dental treatment done. Still, if people, those who are not having any health services, any dental treatment options, or some other constraints, we do have options of for them. uh, so the India, is having multiple cultures, multiple food options people are having. The most common meal in Indian kitchens is chapati and sabzi, as we all know. So it can be one of the options that we can make soft chapatis with a softly kneaded dough. It is one of the most common suggestions I give to my patients कि आप थोड़ा सा soft chapati बनाइए नरम आटे से. And apart from this, in some areas, people rely on rice as their main meal. So rice is not a very difficult to chew. But as already Madhu sir said, we can go for brown rice in case of people with diabetes, and even brown breads. Brown breads are also a very good option. Apart from this, we can go for broken wheats or broken cereals. In common terms, we call it as dalia. So dalia is a very good option for people with diabetes. Apart from wheat, we can go for millets. We can go for oats or barley or anything else. We can rotate the cereals as well, so as to have do not have a nutritional deficiency, because people who follow the diet regime with the same ingredients, they tend to have a nutritional deficiency of any of the macronutrients or micronutrients. So keep on rotating your cereals, pulses, vegetables, everything. So we do have options in this. We can have vegetable soups. So in people who are lacking teeth or having loosening of teeth, soups is a very good option with different vegetables. You can have salads which are finely chopped or grated. You can saute it in low oil, and you can steam it, bake it. You can have fruits which with the low glycemic index, you can peel off their skin if you have issue in chewing. So there are multiple options. You just have to make it easy in cooking if you are unable to get your dental treatment done somehow. So any of the recipes you can follow. There are multiple options.
Thank you, ma'am. Thank you very much. So, sir, Madhu sir, now coming to the other aspect of lifestyle, good lifestyle practices, we all know that exercise is very good for glycemic control. But many people have confusion like which exercises are best, whether they have to go for cardio or strengthening exercise, and how much duration they have to do in each day. Can you enlighten the general public about the importance of daily physical activity?
Okay. Regular physical activity and exercise, I think, is the second most important pillar of lifestyle management, particularly in a diabetic patient. We all know that besides several other health benefits, which I'll also allude to just now, exercise helps better control your sugars. And this it does by improving the action of insulin that is being produced in your body, and therefore helps this insulin to control or utilize the blood, the glucose in your blood, and convert them to energy. And therefore, what we say, it decreases the insulin resistance, so called, and therefore, a direct benefit for a diabetic patient is better control of their sugars. That's number one. And of course, the added benefits are cardiovascular fitness in the long run, a general feeling of well-being, good mental health, and several other benefits which are also important uh, because of the other psychomorbidity psychological um, or psychological conditions associated in a diabetic patient, often which also need to be managed. So exercise and physical activity is a very important lifestyle measure from different points of view. Number one. Now, coming to which exercise and how frequently and duration and so on, these are all well laid down. I think the most important type of exercise that needs to be done by diabetic patient is what we call aerobic exercise. That's the predominant form of exercise that we advise, and this is the exercise which can be easily done. If nothing else, at least a brisk walk is good enough. But if you could do other forms of aerobics, which includes dancing, swimming, cycling, even garden mowing, or any such exercise, all of them contribute to what we call aerobic exercise. And if you do them for, let's say, half an hour in a day, for at least 5 days in every week, that is good regular exercise. And regular exercise, another important thing about exercise in a diabetic is it should be regular, and the general time at which it is done also should be more or less constant. Because if you do exercise, let's say one day in the morning, one day in the evening, the other day you avoid it, it can cause fluctuations of sugars as well, especially in a severely insulin deficient patient. So therefore, you should be having a regular habit, a fixed time, and a fixed duration schedule also is equally important, apart from the minimum that I'm specifying. If your goal is also to lose weight, then half an hour probably will not be enough, and you may have to extend this exercise to maybe an hour every day, and maybe each day, so that you have optimal weight loss as well. In terms of the other type of exercise, are we required to do any other type of exercise other than aerobics, which we're all familiar with? We do call what we call resistance exercise, or working against some resistance. Weights is the most common example which people are familiar with in the gyms. These also do help to some extent in reducing what we call insulin resistance and help glucose control. But you don't have to be as regular as this. Even if you do it for 10-20 minutes twice a week, even that would suffice in addition to the usual uh, exercise that I've recommended. Third, beyond all this, stretching exercises and yoga, if you can do, but don't avoid this. Avoid these two aspects of physical activity at the cost of doing yoga. Yoga is good, but as an add-on to all this.
Thank you, sir. So, as sir has mentioned, exercise is not only good for your uh, glucose control, it also has other beneficial effects like weight loss, reduction in blood pressure. It can reduce your bad cholesterol, increase your good cholesterol, and improve your sleep and memory. So, it's always good that you exercise daily. Ma'am, Sridevi ma'am, like one of the most common complaints by our patient is like they do have 8 to 8 jobs and they don't have time for exercise, or they don't have any nearby facilities like parks or gym to go for exercises. So what is your advice for such patients?
Yeah. So for this, I would tell only one word: where there's a will, there's a way. That applies very much to this. तो अगर अगर आप एक्सरसाइज करने की ठान लेंगे तो डेफिनेटली आप कर पाओगे. हाँ, बहुत ही बिजी लाइफ शेड्यूल हो गया ज्यादातर लोगों को, स्पेशली सिटीज में. उनको ट्रैफिक में भी काफी देर वक्त बिताना पड़ता है, तो शायद टाइम मिलने की डेफिनेटली कॉन्स्टेंट्स होंगे. लेकिन सम मॉडिफिकेशन, लिटिल मॉडिफिकेशंस, जैसे कि 15 मिनट जल्दी उठना एक्सरसाइज के लिए, या और जब आप एक जैसे you're making a routine of your job and all, so you have to try to make exercise as a part of a routine, and this should be inculcated right from childhood. So अगर आप बचपन से ही एक रूटीन बना देंगे तो उनको, तो ये फ्यूचर में उनको प्रॉब्लम नहीं होगा. लेकिन अगर आप रिसेंटली इंट्रोड्यूस करना सकते हो, so you can, if you have a short time, maybe you can do a high intensity workouts, for a short time, rather than going for a 30 minutes walk. If you don't have time for 30 minutes walk, you can do 15 minutes in the morning, 15 minutes in the night. It's not that you need to do continuously. Also, you need to be active throughout the day. Like you can take for example, if you do not have any joint problems and all, you can take stairs instead of the escalator. Or if you're sitting for a long time in front of the TV, which usually happens, so you can get down in between the ads or something. And there are a lot of exercises which can be just done with your hands and feet without any need of gym or anything. And nowadays we are fortunate that there's so many things on YouTube also, very good exercises and all. Just need a single space to stand and just your hands and feet, nothing else required. And they're very economical, very easy to do. And maybe you can take 10 minutes break in between your schedule, not a much break, that will be relaxing for you as well. And play, if the patients are old, they can take their grandchildren, play with their grandchildren. And simple things like gardening in the morning instead of sitting in front of the television. All these small things you can inculcate even if you have busy schedule. So where there's a will, definitely nowadays we have solutions for that. You there are a lot of resistance exercise you can do at home also, like bands and all. So much technology has evolved, and you can definitely incorporate small exercises in between your busy schedules, which may be of a little high intensity, so that you can meet the requirement of at least 30 minutes per day of workout. And if at all you are not able to do, it's not just 5 days a week is recommended by most of the organization to have the best. So if you're not able to do on the work days, maybe on weekends at least you can spend some extra time for your exercise, so that you can bridge the gap of whatever exercise you're not doing on. So basically limit your sedentary time. When you're sitting for a long time in your office or desk jobs, please get up at least once in half an hour के एक बार उठना चाहिए, थोड़ा 5 मिनट ऐसा या 2-3 मिनट टहलना चाहिए. ये काफी प्रॉब्लम्स को कम करेगा. So such small modifications in your daily routine will go a long way in keeping your health in perfect condition. Not only control of diabetes and blood pressure, but other related like sedentary, like venous embolism and venous stasis, varicose veins. All those problems भी कम हो सकते हैं अगर आप ये सब follow करेंगे.
Thank
Can
you,
I add
ma'am.
can I add just two quick points to this?
Yes, sir.
Yes,
Yes, sir. Sure, sir.
yeah, most welcome.
One is that general reply of patients is that सुबह उठ के मेरे को काम पे जाना होता है या स्कूल जाना होता है, I cannot walk, meaning thereby that they don't even consider an option of an evening walk. So walk is good in the morning, but you can always do it in the evening. And in fact, recent studies are showing that evening walk is better for sugar control. So evening walks are just as good. So you don't need to avoid walks just because it's in the evening, number one. The second thing is, as Dr. Sridevi mentioned, in your work or anywhere, from time to time, every hour, it's better to get up and go around. One suggestion which I recently got from somebody, which I liked very much, was we just can't avoid our mobiles. We keep getting mobile phone calls and keep attending them. A simple way of activity can be, whenever you get the call, get up and attend the call while you're walking. Okay, just move around instead of taking the call while sitting. So that itself will fulfill your 60-minute walk in a day, because we would use our mobiles at least for 60 minutes in a day.
Yeah.
These are two things I just want to add.
Very nice, sir. Nice.
Sir, thank you.
Practical tips, sir. Thank you very much for adding.
Sandeep sir, we all know that smoking is very bad for our health. It increases risk of cancer and also heart attacks and risk of paralysis, especially in diabetic patients. So what is your advice for someone who wants to quit smoking? So what are your tips which can help them to quit smoking?
Yeah, very important question, Rakesh. We encounter so many patients in our clinical practice who deal with this problem, and it is like so problematic for them. Apart from all that health issues you mentioned, I also like frequently face this problem where patients have HP levels of very high HP levels, because being having diabetes itself, it increases the risk of your blood getting clot, your artery getting blocked. And added to that, when you have a smoking, that increases your hemoglobin level in the blood. That adds the additional risk factors, whereby we find so commonly nowadays that a young individuals who are in their 30s, 40s having diabetes or mild form of diabetes also having cardiovascular events. So that is very distressing to see. So when faced with this issue and my patient wants to quit, I definitely ask them to consult a health professional who specializes in dealing with addiction. Apart from that, there are also some tips which can they can everybody can inculcate in their daily activities. Like if they are very serious, then they can set a date to quit. It doesn't have to be like immediately, not all of a sudden. So set a date in the near future where you think you can quit, and involve your people like your doctor, your other diabetes care providers in this event, so that you have a built-in support system. And whenever smoking is there, like make it inconvenient to smoke. Like don't keep the things which you need to smoke nearby. uh, Keep them away, very hard to find. So that is one other thing which will be helpful. Then there is other things like involve your friends who are also who are wanting to quit smoking. Spend time with them in places where the smoking is not allowed. So involve yourself in activities where smoking cannot be done, like spending time in libraries or other places. And other thing which we can also try is whenever you have that urge to smoke, there are different behaviors you can involve yourself in, like deep breathing exercises. That can be one thing that itself reduces a certain amount of stress. Um, when you have that urge, you can replace that with a low calorie food, uh, like a low calorie fruit can be had. And other important aspect is to avoid drinks which are having high caffeine in them, like coffee, soft drinks, or alcohol. So they also increase the urge to smoke. So keeping yourself busy with the help of good hobbies, it makes you too busy to get your mind distracted and uh, avoid smoking. So these are some of the steps or the tips which can be used. Otherwise, definitely make use of the help of a healthcare professional who will help you in quitting.
Thank you, sir. Thank you for your valuable tips. Poonam ma'am, next question is to you. As sir has mentioned, smoking is one way to cope up with stress for many patients. So, what are the ideal ways to deal with stress, especially in diabetic patients? We all know that stress levels can increase, cause a spike in their glucose levels. So, how do you advise your patients? Sorry, ma'am, you're in mute. I think.
Sorry. So you have earlier asked me about the protein powders, so I'll answer that first. So as far as the proteins are concerned, Indian patients are mostly deficient in proteins because the Indian diet is mostly deficient. इतना supplement नहीं हो पाता है इंडिया में लोगों को जितना लेना चाहिए. So as far as protein powders are concerned, I personally do not recommend patients taking powders, artificial proteins. Instead, they should take extra protein in the form of, if they are vegetarians or non-vegetarians, take chicken, take eggs, or if they are comfortable with dairy, take paneer and all other forms of proteins. Until and unless any specialist advises you, always take advice of your endocrinologist or your physician. Get your health checkup done first, because there are certain conditions, there are renal insufficiencies where the protein powders or extra protein is not advised. So until and unless you have special needs, do not take protein powders, especially persistently. You can take them intermittently if you want. Check the labels. Take them in moderation. Do not entirely rely on protein powders for supplementation, or do not replace your meal with protein powders or protein bars or any kind of artificial proteins. Now, regarding the stress, so here I would like to answer this question as a person living with type 1 diabetes myself. I am actually living with diabetes for 29 years, and I have seen making this stress my diabetes like hell. I wake up with the sugars like 300 for no reason on some days, because stress directly affects the blood sugar levels. I have seen this. When you are sleep deprived, you are indirectly stressed, your body is stressed, your mind is stressed. जब भी होता है कि किसी भी तरह का टेंशन है, काम का ओवरबर्डन है, आपको नहीं रिलैक्स हो पा रहा है, suddenly the blood sugars are rising. So stress agar kabhi bhi hai, so you have to work on the root cause, that why you are stressed, whether the overburdening due to work or your personal issues, your family issues, anything. Just talk to your friends, talk to your family, talk to your colleagues at your workplace or your boss if your working hours are very hectic. So you have to work on the root cause. आप उस पे काम करिए कि स्ट्रेस आ क्यों रहा है, क्योंकि स्ट्रेस में सबसे ज्यादा, अगर मैं टेक्निकली बोलूं तो स्ट्रेस हार्मोन्स रिलीज होते हैं, जो दीज आर एक्चुअली एनिमीज फॉर डायबिटीज. तो स्ट्रेस के लिए टेक हेल्प ऑफ योर फैमिली मेंबर्स, और इफ एट ऑल यू नीड, टेक हेल्प ऑफ एनी साइकोलॉजिस्ट, एनी थेरेपिस्ट, जहां से भी हेल्प मिलता है, क्योंकि स्ट्रेस इज अ पार्ट ऑफ लाइफ. Every other day you will have another challenges, you will have different situations, different circumstances, you cannot avoid the situations. So start dealing with them wisely, take help from others, and think of that why I am stressed, why I am overburdened, any type of thing you will have to discuss with other people. So this is what I personally do in my life.
Thank you, ma'am. Thank you. Madhu sir, as Poonam ma'am has mentioned, disturbed sleep, they can cause a spike in our sugar levels, and one of the common reasons for poor glycemic control. So, what is the ideal duration of sleep, and can diabetic patient take afternoon naps? Can you give your advice on these things?
Yeah, I think sleep is the third important facet of lifestyle. After, I mean, stress, of course, is maybe the third, and this is the fourth, or vice versa, after diet and exercise. And I think it is an often ignored part of lifestyle. Although we stress so much on the healthy diet and exercise and physical activity, we fail to focus or emphasize on the sleep. Sleep is extremely important, particularly in a diabetic patient. And when we say healthy sleep, what we mean is not only the duration but the quality. So, in terms of duration, it should be at least, I mean, 5 to 7 hours, or some people say 6 to 8 hours. But anything under that or over that, both are harmful. So, don't oversleep, don't undersleep. The optimal levels of sleep should be maintained in terms of duration. That is important. Second is the quality of sleep, and you should have good deep sleep and not disturbed, with repeated awakenings in between and so on. All these things will contribute to lack of control, as has already been highlighted by Dr. Poonam in her own case. So we should emphasize as a routine to all our diabetic patients, and through this program, that everybody should make sure that they do everything to have a good quality sleep. And part of the activities is avoid taking tea, coffee later in the night or closer to our sleeping hours. Don't indulge in late night eating. Preferably have early dinners followed by relaxed activities, and spending a good time with your family, so that you're in a peaceful mindset that allows you a good quality sleep. Not only good quality, but once you fall asleep, you wake up after the designated number of hours in the morning. That will go a long way in controlling your sugars, number one. Secondly, even apart from controlling the sugars directly, sleep also is one of the important barriers, or lack of sleep is one of the important barriers to weight control strategies. So if you don't sleep properly, or you remain awake most of the night, or large parts of the night, or don't have good quality sleep, your efforts at weight loss can be seriously compromised, and frustrate you also. So I think this is so sleep is important. Sleep is important for management. Sleep in general is important for any healthy living, to prevent not only diabetes but all the other lifestyle disorders. So please do indulge or do everything to have good night's sleep. early to sleep and early to rise is not coined just like that.
Yes. Thank you, sir. Thank you. Sridevi, ma'am, what do you feel? What is the role of our family support in diabetes management? So, what role does the family should play for so that the patient can have a good glycemic control?
Yeah, family plays a very very important role. In fact, last year का theme था diabetes and family support, जो वर्ल्ड वाइड थीम ऑफ डायबिटीज नवंबर 14 का उतना इम्पोर्टेंट फैमिली का रिकॉग्नाइज किया है वर्ल्ड वाइड. Because see, whenever I tell food choices is not just for the diabetic patient. Once a diabetic patient in the home, the food choices of the entire family matter. Because if the patient is made separate food and all, they feel deprived also. All this leads to distress and leads to poor glycemic control. So, and whatever healthy food choices which you tell for a diabetic or obese patient is good for it, everyone in general. So if, and also if there's a diabetic in the family, definitely the genetic risk, and also now we know that the environmental risk of having diabetes in the family is also there. So making healthy food choices would not only help the patient overcome his deprivation feeling, and also will help the family maybe to prevent diabetes and all. Second is the exercise activity part. Also, a single person going for a activity without any support, they feel bored, and again they again feel deprived, or why should I do this when everyone is sleeping or whatever. But again, physical activity is important not only for diabetics, for everyone. So if the physical activity, if all the family members are active, then the patient feels more ready to be more active when rather than. So physical activity, dietary choices, and also the stress levels. If there's any family tensions and all, it leads to again stress and poor glycemic control. Similarly, if there are elderly patients who cannot take their medication, some dementia or something, they cannot take their medications or forgetting to take their medicines, or they cannot take insulin on their own. So family support is very important in such words. Similar recognition of hypoglycemia. Sorry. So low sugar, so how to deal with it, and all the family also should be educated. So all this way, family support goes a long way in managing diabetes. The patient is more ready to do dietary modifications, more ready to be active, relieved from stress if there's and able to take medications regularly if there's no family, if there's a good family support, and that leads to better glycemic control.
Thank you, ma'am. Thank you. Sandeep sir, one of the most common mistake done by diabetic patients is they don't monitor their sugars regularly. They tend to check their sugars only once they develop some complications. It may be a low sugar or some symptoms. So, what is how ideally a diabetic patients should monitor their sugars?
Thank you for the question, Rakesh. Very important question. Very commonly, we see in our clinical practice that patients, once they recover, they become relaxed in the form. They sometimes stop medications, sometimes don't uh, adhere to the dietary recommendations, end up with high sugar levels, and some people come back to after a year or so with very high HbA1c levels, very high fasting and corresponding glucose levels. So there is always this confusion when to monitor, how frequently to monitor. So generally, it depends on the blood glucose status of the particular patient. For those who have very high levels, they need to check more frequently, more regularly, let's say monthly or so. I'll be discussing about certain scenarios where you will require even more frequent monitoring. And for those who have normal or near normal levels, may require more occasional checks. So there are tools like fasting glucose levels, postprandial glucose levels, and an average glucose level, that is HbA1c. So this HbA1c is a blood test which reflects glucose levels for example approximately past 3 months. So it is a very useful tool for patients who are meeting the treatment goals. They have the glucose levels in control and the glucose levels are stable. So they need to check HbA1c at least 2 times in a year as per guidelines. So it again depends on your doctor how they feel about your situation. Uh, but because I want my patients to check their HbA1c level also a little bit more frequently. And for those patients whose therapy has changed, or those patients who are not meeting their glucose targets. So they will require more frequent monitoring, like every month, every 2 months, or 3 months. Sometimes your endocrinologist may ask you to do it more frequently on their discretion and based on the situation. Then there are certain special situations which might require daily monitoring, updating insulin dosage, specifically like type 1 diabetes. Dr. Poonam will definitely agree with me regarding this. Then diabetes in pregnancy. Then there are more recently we have newer things like continuous glucose monitoring, flash glucose monitoring. So these new tools are available by which means a sensor is attached to your skin and it is able to record the blood glucose levels more frequently. The advantage is that they do not require repeated needle pricks, which can be very difficult to manage in certain patients. So in patients like type 1 diabetes, gestational diabetes, that is diabetes in pregnancy, uh, these tools are very helpful. And other thing which most patients forget or they are not aware is that the importance of following sick day rules. So sick day rules is for patients who are sick. They have fever, they have loose motions. So during these days of sickness, there will be change in the hormones in the body, so that might lead to fluctuations in the blood glucose level. Or there might be other factors also like appetite is changed, appetite is reduced, eating habits are different during those days. So apart from taking the necessary steps like keeping yourself hydrated, regular feeds, it is critical to check the blood glucose levels in these situations, like at least every 3 to 4 hours. Very critical in case of people with type 1 diabetes that these steps are followed, and additional step which they require is the checking of a urine ketone level. So if these steps are followed, then it will be beneficial.
Thank you, sir. Monitoring of glucose levels is an important aspect of diabetes management, which many patients they neglect, and also meeting the doctor. So many patients they tend to go to doctor only once they develop the complications like increased frequency of micturition or low sugars. So by the time their sugars would have been haywire and they have been very uncontrolled. So it is ideal that all the patients should meet their doctor at least once in 3 months or 6 months so that they can keep their glucose levels and under control, and also can detect development of diabetic complications like retinopathy, any cardiovascular disease or nephropathy at the earliest. Sir, as we are running out of time, I would like Dr. S. Madhu sir to give a take-home message to all our audience regarding the importance of healthy lifestyle practices in diabetes management.
Okay, I think the key message, especially from the last 1 hour's discussion also, which has come through, is healthy living is the key to managing your diabetes and also preventing diabetes. Not only that, also help prevent the other conditions associated with diabetes like blood pressure, lipids, obesity, and heart attacks. So lifestyle is the key. It's the key mantra for all these diseases which are associated with diabetes. What is healthy living? Just to summarize our discussions over the last 1 hour, healthy living is basically a healthy eating habits or healthy diet, healthy physical activity, which is exercise and physical activity, which we mentioned, healthy sleep habits, which we discussed, healthy mental state, so freedom from stress or reducing of stress, and lastly, and we have a dental surgeon on our panel, brushing your teeth daily and looking after oral hygiene. That also is healthy living. So these five components, if we do and maintain a healthy living day after day, not only the diabetic patients but their family members and everyone in the community, I think it'll go a long way not only in treating our diabetic patients but also preventing the upsurge of diabetes. Thank you.
Thank you, sir. I want to thank all our panelists for coming together and enlightening the general public and diabetic patients about the lifestyle, good, healthy lifestyle practices so they can lead a healthy life without any complications. So I want to address all the live audience. So this whole month we have many programs on diabetes awareness and catches on every Saturday from 4:30 to 5:30 about different aspects of diabetes management. Together, we can make India a home to as a diabetic care capital. Thank you all.
Thank you. Thank you very much.
Thank you
Thank you
so
all.
much, everyone. Thank